I actually did not have really any dental influences growing up. I know I went to the dentist, but I don't really remember, meeting the dentist or anything like that. I don't remember the appointments. I never had a cavity. So was actually pre-med when I got into college and thought I was going to be a pediatrician. And so I was pursuing that track the whole time. And then eventually I was like, I'd taken the MCAT, was about to apply to medical school. And my aunt was like, have you ever looked at any other health careers? And I said, no. She's like, well, you should shadow a dentist. And I was like, okay, why not? So I did that summer, and it completely changed my career direction. I really loved what the dentist was doing. I loved the procedures. I liked sort of the immediate gratification that the patients got after the procedure was over and they were either out of pain or had received dentures or anything like that. So I completely went back on my senior year and started looking into how I could become a dentist and what that process was like. And I eventually did a post-baccalaureate program because I was in my senior year, and that's kind of late to decide. I did not have the DAT prep. I had no shadowing hours. And so I did a post-baccalaureate program to prepare me for dental school. I took some higher level science courses. I studied for the DAT. I shadowed a dentist. I was a TA for gross anatomy. So I got to do all those experiences to build my application for dental school. And eventually I got into dental school, and I went to UNC Chapel Hill. And so the process of getting to pediatrics was sort of also by happenstance. I enjoyed dental school. I enjoyed a lot of the procedures. There were some I did not like, and I could quickly figure those out. But generally, I enjoy being a dentist. So I really wasn't sure of what I wanted to do when I graduated. When you graduate your 4 years of dental school, you can go immediately into practice because you're competent to all the scope of general dentistry. But there are programs called general practice residencies that you can do. They're usually housed in hospitals, and you get access to hospital patients who are medically compromised, and more trauma type patients. And so that's what I wanted to experience. And so I did that program in Charlotte, and about 6 months into it, we saw children like once a month. About 6 months into it, I was like, I like treating children, actually. And so I told my program director, we had like an elective time, and I was able to go shadow a pediatric dentist and completely decided on pediatric dentistry. And so I spent a year preparing for that application process, and then I applied to pediatrics, and here I am.